Hello, my name is Dr. Jason Branch, and today we're going to talk about grief. So, when you think about grief, a lot of times we just think about loss, death, the passing of a loved one, passing of friends and family. That's one way of grief, but another way of grief is loss. And for many of us dealing with this pandemic, we've lost a lot of different things. So, when you think about grief, it's not just one sided as far as a death, but it could be the loss of a job, a relationship, or a way of being. You're looking at this video right now because I can't be there with you in person due to COVID. But we're going to get through this. We're going to get through this. And I want to kind of dive into what grief is and ways that we can work through it. So when you think about grief, I want to share with you some of the stages of grief. And these don't go in any particular order. But the first thing that may happen is denial. I don't want to accept the reality that I may have lost a relationship, lost a job, lost a child, lost something. I don't want to accept it. Lost this person. So I may deny it. I may not accept the reality that something is missing, someone is missing, and my life may be changed forever. Another thought could be anger. I'm angry. I'm upset. I'm upset that I couldn't control, I couldn't change the narrative of what happened. And I'm confused. I'm stressed. I'm upset. I can't explain it. Anger is a part of grief, and it happens. It's part of the stage of grief. The next is bargaining. Bargaining is for us thinking about our shoulda, coulda, woulda. I should have did this. I should have said that. I should have texted. I should have did this. If I would have did this, that person may still be alive. If I would have did that, I could have prevented things from happening. Bargaining is also a part of the stage of grief where we believe or we think we could have done something different. Oftentimes things happen that are not in our control. So be mindful of the things that you can control and the things that you cannot. Next is depression. Some of us go into a state of depression. We feel sad. We feel guilty. We feel lonely. We get isolated. We get away. We push ourselves away from other people. And sometimes we're doing that to deal with our pain or coping with our pain. And last but not least is acceptance, accepting what's happened, accepting the reality. COVID-19, some of us have come to the acceptance. This is where we are right now. It's not forever, but it's going on right now. Same thing may happen with grief and loss. That person may have passed away. I'm getting to a place where I can be accepting of what is. So some challenges for you, some homework for you. I want you to consider what is versus what if. What if is what if. These are just ideas. What if this happened or that happened? What is what's happening now. Be mindful of what is. That's what may be in your control. Speaking of control, number two, we got to be mindful of what we can control and not control. And a lot of times when we're dealing with grief, it's outside of our control. Some of us may try to compartmentalize grief where I can be upset, I can be sad for this amount of time. But understand that grief affects us all differently. So it's allowing yourself to cry, to be upset, to be angry, or whatever that may be, for you to take better care of yourself to make sure you're okay. So not only what if, what is, but be mindful of what you can control versus the things you cannot. Number three, looking into grief, learning more information about grief. Grief doesn't look the same for anybody. Find a system that works for you when it comes to grief. Find ways to uplift yourself, or if you want to cry, allow yourself to cry. If you want to run away, if you want to do things, it's accepting who you are and the way that you grieve. We all grieve differently. Find what works for you. Another aspect when it comes to grief is self-care. Typically, when we're dealing with grief, when we're dealing with loss, the first thing to go is our self-care. We're not taking care of ourselves. We don't do anything for us because we're so concerned about everybody else. To me, it's very important when you're dealing with grief and loss to make sure you are taking care of you. The better you take care of yourself, the more you can take care of everybody else around you. Again, my name is Dr. Jason Brand from MHub. Thank you for joining me today talking about grief. Please protect your peace, protect yourself. Find a system that works best for you. Thank you for joining me today. I'll be seeing you soon.